I first noticed that just something as small as pushing an elevator button. Ordinarily, you walk up, you do it with this finger, and I found that when I would do that, I felt a little tenderness in it, and that's actually where it started. At one point, I was out to the mall with my children. And at that point, they was all in their early 20s and stuff like that. And I had purchased a soda, and when I picked it up and was walking out with my hands started hurting so bad that I just stood there and started crying. And when I did, I looked around, and all my kids, even my grown son, was standing there crying also. So at that point, I recognized that, I got to try to get through this, without putting a lot of, burden on them.
The challenges in the treatment of rheumatoid arthritis really are long-term. Short-term, patients are interested in relief of pain, and they appreciate that probably more than anything else to begin with. But the real challenge in the management of rheumatoid arthritis is to try and maintain function, to try and do everything you can to slow down what is normally a progressive, destructive disease that damages joints.
You go to get up in the morning, and you think you're going to throw the cover back and jump right up, but the pain in your neck is so severe that you find yourself having to take one hand and, just to pick your head up, just to get up and sit on the side of the bed. And then there are times when I would sit there and cry. I found it difficult to brush my teeth. Just the way I had to flex my wrist, and just the way I had to hold that toothbrush in my hand. When my arthritis was really bad, I found that I was spending a lot of time in bed. I didn't want to, because I've always been an active person, but I was just having so much pain. It was just painful to get up and walk.
Miss Blake is a lovely woman. She has rheumatoid arthritis, and she's been on a number of medications, including standard drugs like Plaquenil, methotrexate, azolfidine. Was not doing well, did not have a sustained, protracted response to methotrexate.
When I first started going to Dr. Rice, after my original doctor had left the hospital, and I started going to him, his treatment really, really helped me. And then, like all the rest of it, you reach a point where it's not working anymore.
Watching a disease damage the joints and gradually take away functional ability from a person that over the years you get to know really as a friend. I mean, when you take care of a patient and know their family for 20 years, they know about your children, you know about their families and kids. They become a very personal individual in your life. And to watch a disease take that individual and gradually hurt them over a period of time in spite of everything that we do, it's very frustrating.
One day I went in and he told me about Arava, and he asked me if I was willing to try it. And at that point I was ready to try anything. The pain that I was having with my neck, it began to decrease. And I noticed I could do a better job of wringing my washcloth out. Pain in my knees began to decrease, and I was walking better. There was one point where I couldn't raise my arms. I couldn't stretch them out. And the shoulders was extremely sore, the joints and all. Once I started using the Arava, then I told my sister, I said, I'm going to start using that equipment we got sitting out there. So I started going out and doing it, using the upper body. Now that, hey, I can do it now. That's been wonderful.
I think the most rewarding experience is to have a person that was having a tremendous amount of difficulty when you first saw them, especially if they had been exposed to different sorts of treatments prior to their being seen, and were not very successful in achieving a good response. And then after you've worked with them for a period of time, to see them come back and you open the door and say, how you doing? And there's a big smile on their face. I think that's the most rewarding thing.
I guess if you can look at the smile on my face, I guess that tells you a lot. But I feel great. I can start back doing the things I used to do with my grandkids. They could call me at 5:30 in the evening, and I'm cooking dinner. But they say, Grandma, can you take us roller skating? I cut my pan off, and go. And, I take them out to the game room, and I play the games with them. I cherish the time that I spend with them. And now that my health is better, we are really just, having a good time.
Come on, big boy. Come on. We have horses that we have to take care of, well, with the cattle. So you have to bring those in, feed them, turn them out, and then you bring your cattle in here, and they have to be fed every day. So at the present time, we feed those with round rolls of hay. That's something like 1,200 pounds you got to move around with your tractors. And then we mix our own feed to feed our cattle with. So, and then you got fences to build and repairs to do, and so it's a full-time job 7 days a week. I realized that I had something wrong with my body back in probably about 79 or 80. And at night I'd be so stiff, and in the mornings that, I'd be stiffer.
In 1980, at the time that I began my work in rheumatology, there was very little that we had in a line of long-term or controlling type of medications that would be of an immunosuppressive nature. And we were dealing at that time with the golds and with some of the early work in methotrexate.
First thing in the morning, I have a cup of coffee, and I had problems even picking my coffee cup up. Because I just didn't have the strength in my arms, or just didn't have the coordination or something. And running, or anything, I couldn't walk fast. And I even had a trouble saddling my horses, for instance, and toting feed buckets. And I had to have a lot of this stuff hired by people, to do. And not that I quit, I just kept going, but I just couldn't handle it. So then I was roping a little bit, and in different little roping shows around here, and that's you have to get off your horse, go down, tie your calf, come back, and I just couldn't do it. I couldn't even put my calf up, tie him. It affected my whole body, mostly in my shoulders and my hands, and I just lost my strength, and my hands would swell real bad, and my fingers beginning to draw. They wanted to draw up, and I exercise a lot to keep this from doing that, and I just couldn't seem to conquer this thing.
He came into me, and he was really down in the dumps. He was feeling very badly because Jim is at retirement age. He doesn't want to retire. And his big concern was, I'm not going to be able to do that anymore. He said, look at my hands. Look at my arms. I can't do it anymore. And I said, we've got something. We have something new. And I said, let's see what you have to say within the next month or two.
When I went over to see Sally, she right away told me about the Arava, and she said, I want to put this on you, Mr. Glisson. She said, I think this will just do wonders for you. She said, I know that I've been studying this now, but just for a short time, but it's doing so well for me. And in my own mind, I figured, well, here we go again, And you can live with pain, and then you can take pain pills, and you can stop it, but I didn't want to live on pain pills. So at this point right now, like I say, in 6 months, I'm just doing fantastic.
I was very eager to begin the use of Arava, and I have not been disappointed. Having done research with methotrexate for so long, and having had it be my gold standard, probably years before it had become the #1 DMARD, to move me away from methotrexate as my drug of choice in such a short period of time was really an interesting consideration, because I tend to be a cynical next person. I couldn't help notice the difference, quality of life that began to present in a very early measure to these folks. And their response, I had so many people who were startled at their outcome.
I have steadily went back into doing all my farm work myself, with my cattle and taking care of my horses now. and I'm thinking seriously about going back into roping. Real serious about it. So, and it's done wonders for me, this Arava that she's got me on.
If somebody asked me, they said, well, tell me about the side effects of Arava. And I have numerous. I could not tell you how many patients I have on Arava. I haven't counted them, but let's just say there are numerous patients. If you ask me, what are the side effects from it, or for what reasons I've had to take people off of it, I'd have to scratch my head, because nothing comes out as major. In the last 20 years, the progress that has been made in treating the patient with rheumatoid arthritis has been exponential. And what we are seeing today, and I feel it's readily seen in this particular practice, is that we don't see the crippling like we used to. We don't see the canes walking in here, the wheelchairs.
Before I got a hold of this medicine, I just didn't want to go anywhere. I didn't have the get up and go about me. I didn't have the drive to me. And, you know, I wouldn't go to the rodeos and sit in those bleachers, because when I got up, you know, I just couldn't move. And around here, I feel more like mowing and taking care of the place, and, you know, grooming the place some more. And our family life is a lot better now. And my temper used to be bad, but now I'm back to, you know, I'm not in pain and pain and pain. I'm just, you know, life's a pleasure.
Cosmetologist, and something I've been doing for quite some time, and hair, and with the hair I specialize in weaving and braiding. With braiding, I'm close to the head with it, you know, and I'm using my fingers, which causes a lot of my dexterity to be pretty good. Same with the weaving. I'm using needle and thread, you know, and it's on my feet. It's like a 5-hour job, but it's all handwork, you know, and you're using your hands, and if I'm not able to do that, I'm not able to make the money. My back went out on me. That was my first sign. I was going on vacation, went to bed and woke up, couldn't get up. It's a constant, like, stabbing pain, just boom, boom, all the time. And every time I walk, I put my feet on the floor, it was like stepping on the little pins and needles and not quite knowing what the problem was. One physician thought it might be carpal tunnel. He wanted to cut my hands. And I'm thinking, well, if you cut my hands, what are you going to do with my back and my feet and my legs, you know? Dr. Jones, which is my physician at that time, he recommended me to see Dr. Chadoff, who's the arthritis specialist.
Her rheumatoid arthritis began in 1992 or 93 with vague, nonspecific symptoms that were difficult to categorize initially as rheumatoid arthritis.
When I was trying to work with my clients, the pain in my hand had gotten to the point where I was actually dropping my implements. That scared me. You know, when you're dropping hot instruments, and I'm working with hot irons and things of that nature, I didn't want a lawsuit or anything like that, so I had to stop doing a lot of things that I like to do. And hair is something that I like to do. When I was upstairs and I couldn't walk downstairs too well, and my husband's at work, and I'm wondering, now who's gonna get this out of the refrigerator for me? And you just go into tears. I started having problems with my circulation due to the arthritis. I developed ulcer sores on my left leg. That kept me from working because it wouldn't heal. Then I realized I was becoming a diabetic at the same time.
The treatment we were using for Anne in 1995 was hydroxychloroquine, which is Plaquenil, prednisone, and methotrexate 22.5 milligrams per week. In general, the patients have a tendency to attenuate or get used to methotrexate.
I explained to him I didn't want any more methotrexate for the simple reason it made me sick. I took it on a Monday. I was sick all day Monday and all day Tuesday. Prednisone, which I'd read up on, was increasing my diabetes. so I didn't really want to do that. So he kind of pondered there for a moment. He says, well, you know, there's a lot of medications on the market right now. He said, and there's this one I want you to try.
In April, we pulled the trigger and gave her Arava.
Well, it took about a week or two before I could actually realize that I was feeling better. And it kind of like dawned on me, you know. I wake up, I'm going, wait, where's this pain? It was like my second nature to just have it with me everywhere I go.
I was skeptical when Arava first came out. Arava has been a pleasant surprise for me.
So after a while, it started to work a little bit better, and I went back to see Dr. Chadoff, and he's asking me about it. And one thing that I did notice, my knuckles were going down. See, they had started to swell and sit up, and that really frightened me.
To my knowledge, Arava, leflunomide, is the only anti-rheumatic agent that is approved to decrease erosions and damage to the joints.
Shoes with heels, I had to go straight to flats. I could never put shoes with a heel on because my feet would hurt so bad. My shoes have been hanging in the closet and sitting in boxes on the 3rd floor for 4 or 5 years. I can pull them out and put them on, and I can walk in them. You have no idea what that's like for me.
She and I have great trust for each other. I did not elaborate that greatly on the side effects of Arava to her. I did not say specifically to this hairdresser that there's a 10% chance that you could have hair fallout. Anne has had no side effects with Arava.
This year, for the first time, I did my garden. Pleased. And it's been 5 years since I've been able to get in the yard. And I'm telling you, that's a good feeling. That's a good feeling.
The efficacy of Arava is excellent.
Smiling, I guess, is my nature, but there was a time when I wasn't doing very much of that. You know, when you hurt, you don't smile very much, you know. You're trying to smile, but you're always grimaced in pain, you know. I've been told to say, well, you look a lot younger now, and I'm this, what are you doing? I'm not doing anything, but I think it's the frown has dissipated.
I'm a senior accountant with PricewaterhouseCoopers and am in charge of the ExxonMobil merger. I found the most difficult part of work with rheumatoid arthritis was the day-to-day tasks such as lifting books, putting my computer on the table, small things, and also wanting to hide the fact that I had rheumatoid arthritis. I first started having troubles when I was about 15 years old in high school. And I was on a trip and I woke up one morning and my feet felt like they were broken. Ever since then, for about a year, I had a lot of troubles that I would one day wake up and have wrists that wouldn't work or fingers that couldn't move, hips, knees, everything. And finally, after about a year, I went to a sports medicine doctor who said I was just overusing it and such. And finally, he referred me to a rheumatologist.
Telling patients they have rheumatoid arthritis is obviously not great fun, but on the other hand, it's certainly a very important moment in the relationship between the doctor and the patient. And really, it's critical because if you scare them too much at that point, they may not come back. They may not agree to take the kind of medications that you're going to offer them. Unfortunately, there are no medications that are risk-free for this disease.
When I was diagnosed, the one thing that I felt was relief, which sounds odd, but with rheumatoid arthritis, you have days where your immune system is fighting you, and then you'll have days when it's not. So you can have maybe 2 or 3 days where you can't move, you can't function, and then the next 2 days you can be absolutely fine because your body's not fighting you. And it was difficult not knowing what days would be like. And then also, towards the end, thinking you're absolutely insane and a hypochondriac. Easiest equivalent I can say is if you took a hammer to your joints and smashed it. You cannot move your bones, and then on top of that you have inflammation, which makes it swollen, red, and hot. Being a teenager in high school, being told that you could no longer do track or cheerleading or go out at night. Even I had to miss I was the prom queen and had to miss the prom because I was too sick. I went through probably a phase of about 3 years where I was consumed with hate. I wanted to know, why me? Why is this happening? Why can't I have my old life back? Probably the hardest task for a person with RA is turning the key to start your car. And there were so many times in high school, in college, and even with work, where it was physically impossible to start the car. And you would just sit there, and you could not move, you could not get where you needed to go. And it was terrible. You would just sit there and cry because you could not start your car.
I think patients do have a better response to treatments earlier in the disease, so I'm fairly aggressive in trying to start them on some kind of long-acting agent right away from the first day I make the diagnosis.
Once they diagnosed me, they started an aggressive treatment early on.
So first we tried increasing the dosage of methotrexate rather dramatically. We wound up switching it to a form where she could inject it because she simply couldn't take that much by mouth without getting sick to her stomach. And even that didn't really do it. We added cyclosporin in combination now with methotrexate, hydroxychloroquine, prednisone, and an anti-inflammatory. We tried sulfasalazine. She turned out to be quite allergic to sulfasalazine, broke out in a rash from head to toe. We couldn't use that. And so for approximately 2 years, we were really stuck.
I first heard about Arava through the arthritis journals. I subscribe to Arthritis Today, which keeps us up to date on everything that is being developed by the drug companies. And we were all eagerly anticipating the arrival of Arava. I was at the point in my disease where I had tried every single protocol that existed. I was on the highest levels of the most toxic drugs, and I had no options left.
We were stuck. We had nowhere to go. And for approximately 2 years, she tolerated these kinds of medications, which were not fun for her to take. When Arava came out, we talked about the potential risks and benefits, and she immediately said, you know, I'm ready, I'll try anything. Because most of the drugs we've had that are long-acting, that prevent erosions and the like, have taken a lot of time to work, and patients simply can't wait 3 to 6 months to feel better. And we've been very lucky now in the past year to have some new drugs with much faster onset, so that we can expect our patients to actually see significant improvement in a month or two, whereas it used to be 3 to 6 months at the very minimum.
The changes that Arava had on me included the first 3 or 4 hours of the day of severe pain and stiffness. It completely eliminated that. I would wake up and would feel the same as I would feel at 4 o'clock in the afternoon. I first realized the full benefits of Arava when one morning I woke up and was pouring coffee for my husband at 8 o'clock in the morning. And he turned to me and said, "Do you realize you're pouring coffee?" And at that point I realized how much the drug had changed my life.
I'm astonished to see the essentially complete remission in her arthritis. Lisa has always had tremendous swelling in the small joints of the hands, which has bothered her not just physically but emotionally. She didn't like to have people look at her hands. She didn't even like to have me look at her hands sometimes. And she has a lot of destruction of the bone tissue underneath the skin on x-rays. And frankly, I didn't really believe that she would ever get to this point on any drug.
My fingers that were swollen to twice the size of normal were down to regular size. Wrists that had been inflamed for 5 years to the point that I could not wear a watch were normal, were functional in the morning.
Despite all the damage underneath there, she never had deformity. so that now with all the swelling having gone down, her hands look normal and nobody can tell that she's had rheumatoid arthritis. And I think there are going to be a lot of patients who are now going to get these kinds of remissions and are going to be able to get their self-image back, which is really a benefit I hadn't really planned on when we started these kind of agents.
I also have been able to start jogging again, which is something I haven't done in over 11 years. I'm able to handwrite again. I was not able to write with a pen with my rheumatoid arthritis and always used a computer, and even signing my name at the bottom of a receipt was agony. I recently got married and was very nervous that I would get very sick to the point that I would not be able to participate in my wedding. And during the whole process, I did not get sick once. I was in great condition for the wedding, and now am able to handwrite my thank you notes to all of the guests that attended.
Arava seems to be doing as well as any drug I've ever seen for rheumatoid arthritis in terms of being both effective and well tolerated. I have personally taken no patient off of Arava because of a significant side effect.
The year before I started Arava, I took more than 45 sick days. And those days were either because I was immobile, I had a cold, I had an infection, lots of reasons. And during the current year, since I've started Arava, I've had less than 5 sick days, which is amazing.
So our plea as rheumatologists would be for the managed care organizations and other healthcare organizations to open their formularies and have all of the drugs available for rheumatoid arthritis, and let the rheumatologist and the patients decide which drugs are working best for them. It's really very gratifying to see her like this and see her having such a great time in life.
Oh, I am so much happier now. I am able to live to the fullest of every day. I don't dread mornings. I don't have to wonder every day, am I going to be able to get up? Am I going to be able to function? Can I go to work today? And I am almost spoiled with the amount of life that I am being able to live right now.
Probably about 9 years ago, I started hurting mainly in my elbow. Started having some pain. Actually, I started from cutting a tree down when I was getting ready to build my house. It felt like a toothache, except it was your whole body. A nasty toothache. Ache when you're sleeping, when you're awake, it didn't matter. Usually it didn't even matter whether you were moving or not. And it seemed like the less you moved, the more you did hurt.
Rheumatoid arthritis is a form of arthritis that most of our patients refer to as the crippling arthritis. When people come in with joint pains, that's one of the things they want to know. Do I have the crippling form? Gary and I met about 5 years ago, I believe now, something around that time frame. And he was a young man of 30 years of age, raising a young family, and he's an auto mechanic and works hard, and he likes to work.
I always try to work as hard as I can. And with RA, that can slow you down. If you have pain, if you have a lot of stress, mentally it slows you down because you are hurting and you can't get the things done that you say you need to get done. And since I'm in the automotive business, I have people relying on me to get their vehicles done because I need them done in time or a certain date or whatever. When I was first diagnosed with RA, I was put onto Plaquenil and Arudis, and then I was put on a sulfadine and prednisone, which those drugs, they had their effects on them. The sulfadine I didn't get along very well with. I didn't feel right on it. I felt goofy inside. So after I had changed doctors, I was taken off of that and put onto methotrexate, which I took for some time. It didn't seem to make a big effect on me.
When I first met him, he'd already had rheumatoid arthritis for 5 years. And he'd been very cautious about taking medicines because he was afraid of putting these, what he called chemicals in his body, and wanted to stay away from things that he felt might give him long-term side effects. He does have some irreversible cartilage damage in his hands and his feet already. That leads to some functional limitations in his day-to-day life because obviously as a mechanic he's using power tools and wrenches and using his hands all the time.
I'm a mechanic, so I'm underneath vehicles, trucks, cars, whatever it is, and I'm on a creeper quite a bit. So getting up and down off the creeper probably hurt me more than anything, especially the getting up. The getting down part, you can kind of fall on the creeper. Getting up off the creeper, off the floor, was always very troubling to me in the last several years anyway because of my arthritis. In my first year that I had my RA, I lost all my strength just because I quit doing things because it hurt so badly.
When Arava first came out, I was very excited about having another new medicine to use to help treat rheumatoid arthritis sufferers. I talked to several of my partners. We all liked the idea that we had yet another bullet, our armamentarium to use.
When I first found out about Arava, Dr. Smith had mentioned it, who I see now, and he had mentioned the fact that he'd like to try me on it, thought it was a new product that might be able to help me a lot.
Gary has done very well with Arava, and I've been very excited about it because for the first time in probably over 6 months, maybe even a year, he is under 10 milligrams of prednisone a day. One of his biggest problems has been our contentions over the use of his steroids, and in order to keep working, he's had to take dosages of 15 or 20 milligrams of prednisone a day, and that continued right through every other medicine that I'd had him on.
Arava has made a world of difference. That's allowed me to stop taking the methotrexate and take less than half of the prednisone I was taking in the previous years and still feel very well. Actually, I feel 90 to 100% better than I did even a year ago as far as overall strength and pain and just mobility. Of course, I know I've lost some movement in my joints and my limbs and stuff that I'll probably never regain, but it doesn't hurt when it gets out to those limits like it used to. So it's made a world of difference in my life as far as what I can do, how much time I can spend doing it, as far as, work, play, playing with the kids, whatever I'm doing. Where actually I can get down on the floor and play with the kids and not feel like I'm really cramping up to get down there and do it. And they love it too, because they knew Daddy couldn't do that before.
I'm a rheumatologist, and yet I have rheumatoid arthritis. I was 16 years old when I woke up one morning and my knee was very swollen. My parents, who were both physicians, took me from doctor to doctor, and I was diagnosed as having rheumatoid arthritis. I have been on numerous medications that gave me bleeding ulcers, made me rip my skin apart, and gave me very abnormal lab tests. I cannot remember in 25 years of waking up and not having pain. When I gave birth to my 5 children, I couldn't carry them. I couldn't breastfeed because I had to immediately start prednisone after I gave birth. Please remember, rheumatoid arthritis is very scary and it's very painful. It's very devastating to be a young person and limp and have to hold on to things and have your feet fall apart and wear funny shoes. I've had all my toes broken and wired. I've had maybe 65 joint injections. I have surgeries coming up for my hands. I don't think most people realize how important your wrist is. With your wrist, you can't open up a door. When your wrist is hurting, you can't even wipe yourself. And that's such a basic everyday activity that it's mind-boggling when you can't do it. I believe, as the literature states, that we have 2 years to shut down rheumatoid arthritis. Within the 2 years, we are the most successful in making a major impact in this disease. If we wait longer, the joint destruction, the functional loss, the job loss, the pain, the stiffness all sets in. Many of my patients are crippled because we didn't have good medicine. It is now a renaissance for rheumatology. I am so pleased to tell you that we have numerous medications that not only can we make our patients have less pain, but we can actually stop the crippling. Well, I do know that most rheumatologists will tell you that methotrexate is fabulous. I hate to tell you this, it's not. I have many patients who do well, and then I have many patients whose arthritis breaks through. My patients love it when I limp. Not because they like to see me struggle, because I'm one of them. And In January, I was getting ready to go ski in Vail, Colorado, and my right wrist swelled up so much I couldn't even see patients. I couldn't write. I was right-handed. And I started panicking because I had to go skiing in a month. Well, I decided that I watched Arava on my patients, and I said, I won't be afraid either. I started taking it, and within 2 days, my wrist was no longer swollen. I was very, very impressed. I started using it in patients who didn't respond to methotrexate, patients who were struggling. I did tell them it was a new medication, we have great hope, let's see how you do. I was shocked how well it worked. Within a very short period of time, it became my #1 DMARD choice. And in fact, I just started 2 patients today on Arava. It's a very nice, comfortable pill to take. And I think people are very scared when you talk about chemotherapy and the different side effects. And I have to tell you, I've had patients hesitate when I talk to them about Arava. But when they get scared, I tell them, I take Arava. And they go, you take Arava? And I said, yes, I'm one of you. I have rheumatoid arthritis. And they don't believe me. And then I show them my hands. And then I have them listen to my knee. I don't know if you're going to hear this. And then if they don't believe me, I show them my toes and they go, oh my God, Dr. Trotter. Having the experience of pain from my rheumatoid arthritis has changed my philosophy as a physician. In my opinion, it's no longer good enough to make your patients somewhat better and improve some of their complaints. My philosophy as a rheumatologist to make my patients so much better that their neighbors say, you're kidding, you have rheumatoid arthritis? I could never tell, because my patients want to be healthy. They want to be normal. They want to keep up with their kids and do their activities. All the pain you have is for nothing. It depresses you, it gives you hopelessness, helplessness, and it can lead to an addiction. I have seen lots of people with rheumatoid arthritis addicted to narcotics because there's nothing else. I'm so glad that we live in this renaissance. And for me, it's so happy to see my patients do well, because I see myself as a gardener. And my flowers are wilting, so I gotta water them. And they do well.